Hey there. I am sitting in the parking lot of my doctor's office on a Sunday. Yes. Hi, I'm Sherry from Twin Sisters Mastectomy Boutique, and I had a Sunday doctor's appointment, which, it amazes me that with all the years of medical school and all the training and everything my doctor has been through, she's working on a Sunday. Now, it is a walk-in clinic that also does family practice, but literally the doors are closed on a Sunday and they just kind of let the appointments in. Anyway, so I very much appreciate it. But why was I at the doctor's office? Well, a little while ago I had like shoulder problems, arm problems, and I addressed it. And then, she gave me blood work to do and blah, blah, blah. And there's like little aches and pains as, life happens. But here's the thing. I'm addressing these issues early. Now, not super early. I waited probably a month or so about my arm because I thought the problem would go away. Well, it's not going to go away. And she's, with my blood work, she's addressing things. With my arm, whatever, she's addressing things. And we are going to explore other, healthcare options for me. So how does that relate to you? Well, if you are having, a lump in your breast and you think, oh, it'll go away, it'll, whatever. If you see a change in your breast and you're like, oh, that's odd. Well, let's just see what happens. No, go and get it addressed right away. Now, as women, we often don't put our health first and we kind of want to dismiss things. I actually know somebody who found out in like November or December, something like that she had a cancerous tumor. It wasn't breast cancer. I don't know what, I think it was ovarian or something. Anyway, could be wrong. And she waited to February to get it addressed in surgery and treatment and whatever she had to have done because she didn't want to ruin the holidays. She didn't want to not be like fully present and healthy for the holidays. She didn't want to put stress on her family for the holidays. And as a result, she waited till February. And to be honest, she waited too long. She was very ill because the tumor had grown. And that meant more aggressive treatment. Now, that's not my situation. I hope that's not your situation. But the point is, I'm not a doctor or a nurse, but I do know that early detection saves lives. We've heard that before. We will hear it again. I will pound that drum. Early detection saves lives. So if you are finding you have a change in your breast, a change in the skin around your breast, a change in your nipple, you found a lump, you found a bump, something's caving in, something's looking different, something's dimpling, go get it checked out. Because if it's nothing, fantastic. Best news ever. You wasted people's time with your treatment and tests, not treatment, but you wasted people's time testing you. Fabulous. Best news ever. Or you can detect something early. Okay, so if there's something there, get it detected early. And if you think that there's something there and your healthcare team is like, don't bother, you're wasting our time, which I've heard has happened to a lot of people. Clients who come in to see me have told me the same thing. They said I was too young. They dismissed me. They told me to go away. And when people have fought for their treatment, not treatment, again, I keep saying treatment, but when people fight for their testing, sometimes there's something there. And if they fight for their testing, and it turns out nothing's there, that's fine. Don't feel foolish. Don't feel embarrassed because there's a bunch of people who are fighting for the testing and there is something there. Am I rambling now? Okay, so if you see something, go get tested. And if you're thinking, oh, well, I've got I've got my family to take care of, I don't have time to go to the doctor. Well, guess what? If you get sick and you go through treatment, that's time away from your family. So why not get ahead of the game so that you can take care of your loved ones better, right? I don't know what else to say other than tell me about your experience. Did you see something and get early detection? Did you see something and ignore it? What has your experience been? Did your healthcare team give you a hard time? Were they supportive? I have to say my doctor's pretty good. Like, she doesn't hesitate to send me to whatever specialists. I live in Canada, of course, so I think that helps. But she's, she, you know, anything. Oh, go see a specialist. I don't know if that's good or bad, but at least, you know, I'm seen. So I am going to leave this parking lot, drive home, and don't forget to like and subscribe, and we'll see you soon.